I guess when the doctor at the VA hospital told me they needed to move my father from a cure facility to a care facility, I, of course, had a lot of concerns.
It's been important because I've had some serious health issues for me to make plans.
It was a relief, really, because I was still working and couldn't be there all the time, and I felt like my dad had excellent care.
I'm just really very happy to be involved with it. As I said, this is important. I think it's very important that people have an opportunity to leave in a very graceful way and with a sense of peace and a sense of closure and as pain-free as possible. So to be able to help with that on a regular basis, it's gratitude.
They didn't act like they were there just because it was a job, but because they actually cared, and so I was very pleased.
And I'm thrilled, actually, to be a part of this, because for me personally, it's something I've had, it's a value of mine and something that I've felt pretty deeply about for a long time.
In Treasure Valley, we have a lot of hospices. We have some good ones, we have some bad ones, but we only have one excellent one, as far as I'm concerned, and that's United.
At United Hospice, we have a passion for the care we give our patients and their families. Ensuring quality of life is our main goal. Every United Hospice patient is offered a full range of complimentary services, including massage therapy, salon quality hair and nail care, companionship from trained volunteers, and much more. Our care staff includes registered nurses, certified nursing assistants, social workers, chaplain services, and volunteers to provide you and your family the support you need. Our hospice services are almost always covered by your Medicare or Medicaid benefit, with no out-of-pocket expenses. United is more than a name to us. It's a way of bringing the best people and care available to you and your family to make this phase of life as fulfilling as possible.
I've observed your nurses and your aides, and touch is a very important piece of end of life. But I think respect is the biggest thing too. Your staff has been trained, they know end-of-life care, but they also have a great respect for the elderly or for any of the residents that we have that need hospice.
You really need to do your homework about what you're going to do for your future. Don't just think about your kids or your grandchildren. Think about yourself. What do you want? And that all worked together for, I think, the best decision for my kids and grandchildren.
I know that when we transferred him to the from the VA hospital to the nursing facility, hospice was there waiting for us. I mean, they were there before we were there. So that experience was just, my initial impression was this is going to be a good experience.
Well, I think the thing I've appreciated the most about United is the very quick response. You know, a lot of people promise a lot of things, but what do they actually deliver? And it's very important to our residents and their well-being that they have an immediate and quick response, and that the person who is responding quickly comes in a compassionate, loving manner. And I think that not all healthcare professionals have the same concept of what a good bedside manner would look like. And I think United definitely exceeds our expectations in that area.